Hey everyone! If you are planning to sell medical devices in Hong Kong, there is one critical requirement many foreign manufacturers underestimate: the local responsible person, also called the LRP. And honestly, this single issue has delayed, blocked, or completely damaged market entry plans for many companies. We've seen manufacturers say, "We already have CE marking. We already have FDA clearance. Our distributor will manage everything. We don't need local support yet." But later they discover, without proper LRP structure, their entire Hong Kong strategy starts collapsing. Because lack of proper LRP support can create delayed submissions, regulatory communication failures, import complications, distributor conflicts, post-market compliance risks, lost commercial opportunities. And the biggest problem? Many companies choose an LRP based only on low price, without understanding the huge regulatory and commercial risks involved. So in this complete guide, we'll cover everything: what an LRP is, why Hong Kong market access depends on it, step-by-step LRP appointment process, timeline expectations, cost breakdown, hidden costs companies ignore, documents required, common mistakes with real examples, distributor versus independent LRP strategy, how to reduce compliance risk, how smart manufacturers protect long-term control, and trust me, if you're entering Hong Kong in 2026, this video could save you months of delay, distributor dependency issues, and major compliance problems. Let's begin. Part 1. What is an LRP and why it matters? What is an LRP? LRP means Local Responsible Person, under Medical Device Administrative Control System. Foreign manufacturers often require local representation support for medical device activities in Hong Kong. What does the LRP do? An LRP may support regulatory communication, submission coordination, post-market surveillance communication, complaint coordination, safety issue handling, documentation management. Why this role is so important? Because regulators need a reliable local contact point. Without strong local representation, communication becomes difficult. Compliance management weakens. Market access slows down. Real example. A manufacturer assumed its distributor could informally manage regulatory communication. Later, important authority clarification was delayed. Submission timeline extended. Result? Product launch postponed by several months. Key insight. A weak LRP strategy can damage both compliance and business growth. Part 2. Why products fail to enter Hong Kong without proper LRP. Problem 1. No local regulatory coordination. Without LRP support, authority communication becomes inefficient. Why this matters? Medical device submissions often require clarifications, document coordination, local communication management. Without structured local support, delays increase rapidly. Problem 2. Distributor dependency risk. This is a huge commercial problem. Some manufacturers appoint their distributor as LRP. At first, it seems easy, but later, distributor relationship changes, commercial conflicts arise, market control becomes restricted. Real example. A manufacturer wanted to change distributors, but original distributor controlled regulatory representation structure. Result? Commercial transition became extremely difficult. Key lesson. Choosing the wrong LRP can create long-term business dependency. Problem 3. Post-market compliance weakness. Hong Kong compliance does not end after submission. Post-market obligations may include complaint handling, safety coordination, regulatory communication. Without experienced local support, compliance gaps may appear. Problem 4. Delayed submission timelines. Many companies underestimate how long LRP setup itself can take. Delays often happen due to contract negotiation, authorization documents, internal approvals, regulatory coordination. Example: a manufacturer finalized documentation but delayed LRP appointment. Result: entire submission postponed. Key insight: even perfect technical documentation cannot compensate for weak local representation planning. Part 3. Step-by-step LRP appointment process. Step 1. Determine your market entry strategy. Before appointing LRP, manufacturers must decide direct market control, distributor-led model, independent representation strategy. Why this is critical. Your LRP structure affects commercial flexibility, distributor control, long-term expansion strategy. Common mistake: rushing into distributor-controlled LRP setup. Result: reduced business flexibility later. Step 2. Select experienced LRP. Important evaluation areas: regulatory expertise, communication quality, response speed, market experience, compliance capabilities. Biggest industry mistake: choosing lowest cost provider only. Example: cheap LRP provider responded slowly to authority requests. Result: review delays increased significantly. Key lesson: cheap LRP support can become extremely expensive later. Step 3. Prepare authorization documents. Common documents include authorization letter, manufacturer information, device details, quality certificates. Common problems: missing signatures, incorrect company names, expired certificates. Result: documentation delays. Step 4. Technical document coordination. LRP often supports coordination for technical files, labeling review, IFU consistency, submission management. Common problem: manufacturers assume LRP only submits paperwork, but weak coordination creates submission inconsistency, clarification requests. Example: technical file and IFU used different intended use statements. Result: authority clarification requested. Step 5. Submission and communication management. Once submission starts, communication speed becomes critical. Common problem: slow LRP response handling. Result: extended review timeline. Important insight: fast regulatory communication often reduces approval delays significantly. Part 4. Timeline breakdown. LRP appointment timeline. Simple cases, 1 to 3 weeks. Complex commercial agreements, 1 to 3 months. Possible actors. Affecting timeline: contract negotiation, internal approvals, document readiness, market strategy decisions. Common timeline mistake: companies start LRP process too late. Result: entire market entry delayed. Example: a manufacturer completed technical documentation but delayed local representation planning. Result: product launch postponed by months. Key lesson: LRP planning should begin early, not after documentation is finished. Part 5. Cost breakdown. Direct costs. LRP annual fees. Regulatory support fees. Documentation coordination. Communication management. Hidden costs. Delayed market entry. Distributor dependency risk. Contract disputes. Re-registration complications. Biggest financial mistake. Choosing low-cost LRP without evaluating long-term business impact. Example, changing LRP later required major regulatory coordination, commercial restructuring. Result, significant additional cost. Key insight, the cheapest LRP option is not always the cheapest long-term strategy. Part 6, documents required. Administrative documents, manufacturer information, authorization letters, business licenses. Technical documents, device description, intended use, test reports, risk analysis. Quality documents, ISO 13485 certificate, manufacturing information. Labeling documents, labels, IFU, packaging information. Common documentation errors, mismatched company details, expired certificates, missing authorization signatures. Result, delays and clarification requests. Part 7, biggest mistakes to avoid. Mistake 1, choosing distributor-controlled LRP without strategy. Result, long-term dependency risk. Mistake 2, selecting cheapest provider only. Result, weak regulatory support. Mistake 3, delaying LRP appointment. Result, submission delays. Mistake 4, weak communication planning. Result, slow authority responses. Mistake 5, poor documentation coordination. Result, clarification requests. Mistake 6, no long-term market strategy. Result, commercial flexibility problems. Key lesson, the right LRP strategy protects both compliance and business control. Part 8, how smart manufacturers handle Hong Kong entry. Best practices, start LRP planning early. Choose experienced regulatory experts. Protect long-term market control. Ensure strong communication systems. Align documentation carefully. Plan distributor strategy properly. One powerful sentence. Smart manufacturers don't just appoint an LRP, they build a long-term market access strategy around it. Tranning medical device entry into Hong Kong? Don't let weak LRP strategy, distributor dependency, delayed communication, poor planning block your market access. Why choose OMC Medical? Hong Kong LRP expertise, independent representation strategies, technical documentation coordination, faster approval planning, regulatory communication management, end-to-end MDACS support. Whether you're entering Hong Kong for the first time or trying to fix an existing LRP issue, talk to OMC medical experts today. If this video helped you understand why LRP support is critical for Hong Kong market access, follow OMC Medical for more regulatory insights, compliance strategies, and global medical device market guidance. See you in the next video.